Hi, and welcome back to another episode of The Architecture of Health. I'm Deb Boyson, and this week my guest is Dr. Cuan. He is Move Med UK on Instagram. He's also a doctor of chiropractic medicine and knows just a lot about movement longevity. Welcome to our show, Dr. Cuan.
Thank you so much for having me, Deb. Yeah, it's really cool. I do love these longer form chats, so it's great. Great to have me. Thank you.
Well, it's an honor. I learned so much from the amazing people that have donated their time teaching the world about what really works. And this is a long-term situation. And what I find most compelling about you is you have a thriving chiropractic practice. You could just stay there helping people get a quick fix, but you've clearly moved into the space of identifying the most important ways to empower yourself for movement longevity. So, and what I love about some of your posts, guys, if you go to his Instagram account, MoveMed UK, you'll see he'll have like a 20-second, like do this, do this, do that, very clear information. And I'm telling you, they are, from everything I know, he's picked some of the most potent positions and exercises in the way he's approaching it. So, what what I love is too, you'll say your chiropractor doesn't want you to do this, but you're a chiropractor. Or you'll say, my brother is an orthopedic surgeon and he would say this is BS. So let's start there in your unique position as all this education in how to externally fix problems. And then what drove you, what compelled you to start helping empower people with long-term, movement longevity, I guess is what we'll call it.
Brilliant. Yeah. So my brother is actually a real orthopedic surgeon. So I think quite a few people think it's actually a joke, but he's actually a surgeon. He specialized in knee and hip surgeries. He's done a fellowship in robotics. So like he's literally one of like the top guys in Cape Town. Like he really is a genius. And he's my best friend. And yeah, so he's the doctor who replaces joints. And then in the family, I'm always the side hustle doctor who tries to prevent that from happening. And everyone thinks that there's always this like hate thing between doctors and chiros, or between everyone and chiros. But the reality is that sometimes a joint needs to be replaced. So if you're going into the surgery stronger, fitter, with better blood supply to the joint, you will recover faster. It's a fact. So movement is medicine, regardless of where you are. Like if you're going down the route to see my brother eventually, you still need to be exercising. Uh, and then yeah, I'm from South Africa, as you can hear probably. In South Africa, the chiropractic course is 6 years, so it's really quite in depth compared to other chiropractic courses in the world. For some reason, yeah, when it arrived in South Africa, I think in the 80s, it was just very strict, and like it was a bit of like a voodoo in the 80s, so they had to have a very structured course. So the course really is incredible. So yeah, you basically do 3 years medicine, and then you branch off and you specialize into like hands-on care. So like we do systemic pathology, diagnostics. We're in hospital like rounds, like seeing medical hospital patients for in our third year, and then you go into seeing like hands-on chiropractic stuff. So I feel like you like leave there knowing quite a bit, which is great. And then obviously you get into private practice, and it's just like you know nothing again, right? um, so yeah, then that was basically I qualified in 2012, 2013, around there, and then I went straight into private practice, and yeah, the rest is history. I mean, we can speak about all of that now, but yeah, basically over like a 10-year journey in private practice, I ended up writing a book. COVID helped that. COVID, I was unemployed for a few months, obviously, well, not able to touch patients, and I didn't have any online practice then, so helped me finish the book. And then yeah, pretty much it's in the book we actually mentioned the NRE, or Neural Reeducation Protocol. This was the master plan when I wrote the book. Is unofficially like I was treating patients with this like protocol where we're trying to focus on the science of longevity and neuroplasticity to help patients. So it's not just like crack a patient, send them home. We're actually trying to really change how the brain works around a movement or a joint. And then we basically just put it into like a little protocol. And the protocol is basically it's education based, it's movement based, and then it's moving forward based. So there's like three distinct pillars of it. And basically my Instagram is the like one section of that where we're introducing new movement patterns to the brain. So that leads into my next thing, where it's like what I do for a living is essentially pain management and movement longevity. So the pain management is what normally brings people in the front door, and the movement longevity is what normally keeps people coming back every now and then. Um, so yeah, that's a bit of an introduction.
So I love it. And to reiterate, your book title is Why Movement is Medicine. So and yet the arc of what we all know is people kind of don't pay attention till there's chronic pain, and that's when they start awakening to the kinds of resources, whether it's orthopedic or chiropractic or massage, or and getting them all the way past that into the longevity point of view. What do you? Why do you think this is kind of just now getting more apparent? This movement longevity idea.
Yeah, so I think in general, there has been a shift in public health, right? So for years, it's been biomedical model where medicine and drugs fix everything, and obviously medicine is essential, like obviously. um, but yeah, I think now a lot of people are trying to take their health into their own hands, and I think, like I always joke with my patients, 20 years ago, it was cool to get drunk. It really was cool to get drunk. It was cool to lose your name and throw up. I was still at school then, but now it is cool to be healthy. It is cool to Instagram your food. It is cool to move. And there's a bunch of us now. I'm sort of mid 30s, but like 30s, 40s, 50s. People are now perhaps starting to move, but they've been in corporate or sitting life for 10, 15, 20 years. And the thing with fitness is that you actually gain quite a bit of fitness quite quickly. So you feel like almost overconfident in your fitness if you start exercising. But what people don't understand is that the body has to adapt and tissue needs to develop some tolerance. So just one example, I mean, everyone in the world is running now or wanting to run. But if you're going from like a static job or a sport where you're sprinting, like a footballer, for instance, in the UK, and you start doing marathon running, you just need to spend the time, like one year to 18 months. You just have to be um, developing that tissue tolerance of the tendons, ligaments, but also changing your fast twitch to your slow twitch fibers, and all these things take time. So when people start moving, they often get pain, which is frustrating. But I always tell patients, I'd rather treat you for an overuse injury than an underuse one. uh, or the nugget, clinical pearl.
Rather treat you for, and I'm one of those overuse people. That's where my crashes would happen, is going from one, sitting extreme to athletic extreme, and honestly overstretching. That's one reason I call myself yoga survivor, is I would just accept at face value something is supposed to work, and just, oh, more of it is better. And what you're and what you're talking about is there's actually functional movement and adaptation towards something. Okay, so this is a question. How do you define movement longevity? Like, how do you look for markers now that we're on that path towards an enduring resilience? Because like I said, sometimes you said you'd rather treat an overuse injury than an underuse injury, and yet it can go to such a point where you're overusing, get injured, and then get scared and start underusing. And so getting some idea of the direction, is that described in your movement pillars, or how would you describe this knowingness, this verifiability that something is building movement longevity?
Yeah, it's a great question. So if I'm meeting someone in the clinic, they most likely have come in because of some kind of pain or injury, or they're just not happy with how their body's moving. So the first step of longevity would be remove what's causing the issue. So in terms of the neural reeducation, the NRE protocol that I do with patients, there's three pillars. There's remove, like take away. Then there's re-move, as in physically removing the body. And then there's moving forward. So the first thing that I think we all have to do is remove the things that are causing the illness in the first place. So if it's inflammation in your body, if it's a dietary thing, or if it's one of the four pillars of movement that you're not doing, we'll speak about that now. But it's removing what's causing the injury or dysfunction. Then the removing, physical removing, that's what we can do in clinic hands-on. So like that's where if I can see someone hands-on, it is just better because it's probably quicker to get someone moving, physically helping them move. But then that's also where my Instagram stuff comes in, where we're introducing new movement stuff, you know. So like those like videos where like if I'm telling someone to push against their head isometrically while the pelvis is doing like penguin movement, that is helping the body mobilize joints. So we can kind of help the body a little bit, but sometimes the specific stuff just needs a bit of a hands-on help. Anyway, so that's the second pillar. And then the third pillar of the treatment protocol is just moving, which is then now strengthening going forward. So in the realm of the moving forward, there are four pillars of movement that I like to just kind of simplify. There obviously probably are more, but I think you should agree with it maybe. Let me know. So the first pillar is flexibility, mobility. So that's where your yoga comes in. So you said that you were almost like an over yoga type personality. So yeah, mobility. Sometimes you can be too mobile, but then you aren't working on the other three. Then there's balance or proprioception. So I recently just posted a clip of myself standing on one leg with my eyes closed, and it's just got such a big like share rate. And I'm like, wow, people are just desperate for the basics. So mobility, proprioception, which is balance, strength. Strength is if I could only do one of the four pillars, I would do strength, which is an interesting one. But yeah, strength is speaks for itself. So like that's where the long-term moving comes in, is strengthening your body and never stopping, because strength stimulus maintains muscle mass. And then the fourth pillar is endurance. So it's pointless being able to lift a heavy weight if you can't lift it and carry it for a distance, you know. So I think those are the four pillars that we grew up. If we needed to survive in the wild, that's what you need. Often people say, Cuan, why must I learn to dead hang? And I said, well, if you fell into a hole in the bush and you needed to hang onto a cliff and pull yourself up, can you do that? If you can't, you're dead. So there's a few functional movements that we work on, which we can speak about later if we have time, if you want to.
Well, yeah, I love the prioritization here and strength, saying that it's the one, if you could only do one, do that one. At the same time, I've also studied joint centration and ways to work along the fascial slings and ways to mobilize the most support value of the kind of springs in the tissue. So I got really fussy about what strength activities I would do. Could you talk about discernment with prioritizing strength? Now, I heard, though, in what you said, I heard you say from an evolutionary biology point of view and a survival point of view, there are obvious types of things you need to do to survive. And that's one reason I study sprinting, is if something bad is happening, you need to be able to move pretty quickly towards or away from something. Why don't you talk a little bit about how do you prioritize strength practices?
Wow, it's a big question. So yeah, I think that's literally its own whole day long podcast that we can speak about. As a chiro, I'm focusing on particularly spinal strength longevity, like in the spine. So I think you and I both are sitting right now. Most people sit with your legs in front of you. So we have this predominance for, generally speaking now, like generally people are tighter in the hip flexors, perhaps not as strong in their extensors. So yes, strength for the spine. We want to get strong in extension from a flex position. So like when you tell someone to do a Jefferson's curl, where you're bending your spine like a fishing rod, 99 patients out of 100 will say that's not good for your spine. And I think that's just where like the general health advice came from years ago, where bending breaks your back, you know. But it's an essential movement. So that's one of the movement pillars, movements that we teach patients with the MoveMed 8, which is like the spinal strengthening 8 movements. The MoveMed Bend, the Instagram stuff where we're doing lots of side bending. Again, I think hits a note with people, because people tried it and they were like, wow, that was tight, you know? So I think because we are so up and down, front orientated, when you start introducing the side stuff, it's a great neurological awakening in a way. And then, yeah, so I think with the strength, yeah, honestly, I think it's a big can of worms. I hope that answered part of the question.
Well, I think part of it is you also alluded to that you've already got resources where you've picked out some strengthening movements, and honestly, movements in uh, various directions using various aspects of our spine and our sensory system they're strengthening something. Because I know, like, my mind immediately when I hear strength, I used to just jump to weight room. That's what that is. And I've learned how movement is everything. It's not the 1 hour at the gym, it's the 23 other hours of the day. And there are positions that our body stops using when we're leaning onto the back of a chair, and or having our legs folded all the time. There are, and so that's the other thing you're saying is there's you've prioritized things, and you prioritize things with your clients so that they bring up the likely deficits they have as being part of a culture that spends so much time at chair level and not moving enough and not walking. Not
Yeah.
walking. I like that you say moving forward, because that's another thing. Like you're talking about the Jefferson curl where the lower back rounds. And in my experience, when you have a round lower back and you suddenly twist, that's when people are getting injured. So people are then terrified of rounding their lower back. And if you think about the primal context, there's a sling. You're able to, when you've got healthy tissue back there, you're able to project something. You can, and that's one thing I learned from one of my teachers, mentors, Bam Lionheart, primal movement, is if we think about lifting, what if we, instead of thinking about lifting, we think about moving things? Like, I'm going to move this bucket of water. I'm going to move this weight, and it not necessarily all being this frontal static situation. And one last thing I wanted to say, I love that you said the penguin moves of the hips, because our hips get locked when the tail is tucked and we're leaning on a chair, and we don't realize the capacity our spine has to drive integrated movement. And the funny thing is, when I first started training myself to sprint, the first thing I do is penguin. I'm like getting my penguin hips going, and then I get my pony knees, and then I start pulsing, and then I'm a puma. Anyhow, okay. So,
Um,
yeah,
before I forget, remind me to tell you the story of the Wagyu steak.
let's
Okay.
do it. Let's do it.
Wagyu steak. But what you're speaking about now, so I'm grateful that with my work, I'm seeing MRIs of patients' spines every day. So a few years ago, about 5 years ago only, I had my first X-rays done of my spine. I've never had spinal X-rays done because I've just never been that in pain or anything like that. So we had X-rays done just because it was in the clinic that I was working in, and it turns out I've got a congenital fusion. So
Where? L4,
L
L5?
L5S1. So yeah, it's a syndrome where there's like different stages of it, but my L5 at the bottom on one side is fused to the sacrum. So my spine is completely wonky. Like I haven't got a scoliosis, but I need to keep my hips mobile. So I've been doing it for 5 years. I've been very conscious with my hip mobility. And for instance, on Instagram, when I put my foot on a block and I'm doing some things, people are all asking like, "Are your knees straight? How are you doing that?" And my answer is 5 years of practice and 5 years of me being probably a little bit nervous of arthritis and spinal stuff in the future. So sometimes you can channel a bad diagnosis into a positive energy, you know. Um, I am a major practitioner of positivity. Like you could show me a X-ray or MRI of a disc that's bulging, and I'll be like, cool, everyone's discs are bulging, most people's discs are bulging. I'll show you a graph of asymptomatic patients with discs, and I'll be like, cool, let's just get you moving. Like it's fine. But the same scan could be told to a patient, your spine is broken. You need to see me twice a week for 100 weeks, and you can go down this pathway of dependence on a practitioner. Whereas I like to go the other way of come see me because you want to keep yourself accountable, you know? So yeah, there's a like a whole shift in like I think just how some practitioners work.
And what's not obvious, at least wasn't to me when I had more of a surgical model, is the amount of tissue damage you have to do to just get into a disc, and the amount, all the pressure systems, the fascial slings, everything has to change, which, like you have said earlier, that means movement is also, no matter whether there's a surgical intervention, the accountability and the follow-up movement and the preparatory movement are really key to restoring function, especially if it wasn't an acute accident that caused the injury, if it was like a chronic thing. Now that you also, we'll get back to Wagyu steak, but I think what was it? I was 19 and a chiropractor looked at my neck and said I had the neck of a 70-year-old, and then they saw an underdeveloped L4 vertebra. So I have this weird hypermobility And like you, I've just learned to manage and aim at integrating as much movement I can in my entire body. And I just love your, yeah, adding that little block in the exercises you're doing is as close as you can come to approximating a healthy gait cycle without moving forward through space. So I think it's really genius. So Wagyu steak, what about it?
So yeah, so I'm in this unique place where I can like sometimes correlate scans with symptoms and people and lifestyles, and we can rescan in the future. So yeah, Wagyu steak. Have you eaten a Wagyu steak before?
Yes.
So obviously it's super fatty. It's got marbled fat in the steak, right? So you've got this big chunk of meat, and inside it is just lots of balls of fat. We can see that in the human spine when there is no movement. Okay, yes, light bulbs. Okay, so when you MRI the spine, you get like cross sections, obviously, and especially in the extensors, like parallel to the lower back, in those muscles there, you can get something called fatty infiltrate. It's just Wagyu steak. Okay, so what's happening is that those muscles have been in spasm for so long that they just aren't actually firing. So like those muscles have gone into spasm to protect your back, probably because it's been forward flexed in a chair or whatever. Like, but the point is there's no movement at that muscle. And we get patients moving and we teach them how to extend their spine. And obviously there's some treatments where we get the rotation back mechanically, and we teach people how to exercise, and we keep them accountable, and we keep going, keep going, keep going. And you re-MRI and the Wagyu steak goes away.
Oh, I love that you have measurable evidence because that's honestly the hardest bridge to cross is measurable results. From the inside, we can't tell, and then except pain is this giant flag. And until I learned to analyze gait patterns, I had no kind of measure to see if I'm becoming more regenerative, rebounding of the gift of gravity. But even then, I can't tell at a tissue level if I'm compensating somewhere else, if some toxicity is building up. I learned recently, I was re-listening to a lecture from one of my old mentors, very fast. He was talking about when a muscle is just used all the time, it becomes toxic. And it's actually overall the stagnation and toxicity that eventually acidifies and starts to attack at the joint level. Do you have, see, that is a unique superpower that you have by being a professional and a movement enthusiast, right? A medical professional and movement enthusiast. What other large patterns do you see that the rest of us can't see out here sitting, listening to YouTube?
Um, so in clinic, we do lots of hard trigger point work, like try break up the fascial restrictions between muscle groups. And yeah, this is probably I haven't heard this before online, so hopefully this will get out somehow, you know. Maybe Huberman will maybe Huberman will like hear this, and maybe we'll be a guest there one day. But you know you got the QL muscle. So the QL is the side lateral stabilizer and mover of the spine.
Diagonal muscles on the back above the sacrum, kind of connecting the
Yes.
iliac.
So yes. So it like does mostly side stuff, but obviously can help with like all movements. But anyway, so you got the QL, quadratus lumborum. Then literally in front of the QL, you get the psoas, PSOAS. So the psoas is a back muscle. It's like it attaches to your spine, and it literally shares a fascial attachment with the QL. So when you get a pressure into those like that muscle junction, it is excruciatingly painful, and it feels like you're pushing into bone. And sometimes it's just where those two muscles have become so merged because of lack of movement, and those like restrictions, the restrictions have actually just built up. That's one reason to see someone, because I don't know how much exercise will get that fascial restriction moving
Adhesion.
if it's been adhesionally locked forever. And yeah, coming from South Africa, we've hunted before, and like when you're skinning a like animal, sometimes you like get to a point where there's a fascial restriction. A knife doesn't even cut it. So yeah, that is a negative. That if you've got them, it's like no hope. But there's always room for improvement. Keep the muscle around it pliable. Keep as much of the movement in the fascial sheath. So yeah, there's always a reason to see someone. There's always a reason to keep moving.
Right. And I heard as a hypermobile person, I ran into the extreme of that where I started over releasing places that were already released. And then suddenly my hip would just go back. And I think actually at the root, I think it was PTSD stored in a psoas. One side was just like, no, what about that? And that's actually another reason to go to a professional who will identify a balanced approach to doing a release. I mean, I think movement from the inside out, especially even diaphragmatic breathing training, is one of the better, safer ways to uh, retrain fascial uh, pressures and tension lines. And yet, what you're saying is you've helped a lot of people, and especially seeing that when an animal with skin, you can't even cut through some of that with a knife. Wow, that's also great info. So how do you coach your clients who love being sedentary into this shifting towards these four movement pillars?
Even if your posture is quote unquote perfect, as in like textbook perfect, like whatever that is, being stationary isn't good. So even if you've got the standing desk and you're perfect, stationary is not good. So in my book, I stole someone's phrase somewhere that said sitting is the new smoking. I've changed that now to stationary is the new smoking. Um, yeah, it's a good one actually. And so when we try to get people out of the sitting posture, we teach them how to break the posture during the day. So I used to give patients when I first started, like you're very enthusiastic and you want everyone to do marathons and you want everyone to be super jacked and you naturally give more homework than you should to a patient. So now I try to keep things simple. So like we've summarized, like if posture improvement is a patient's goal, then we give them three movement patterns pretty much to work on at first. One of them is like just opening up the chest as often as you can. So and like this is the education is that we're teaching a patient. So like we tell them go hang through a door for 10 seconds and that's all you have to do, but then do it again in an hour's time. And then everyone's like, wait, only once? I'm like, only once every hour during your workday? And they're like, but that's easy. I'm like, if you've done it every hour for the next 6 weeks, I will sponsor your treatment for the rest of your life because no one's ever done it. But so like that's one movement pattern. And why we teach it is that when you stretch that whole anterior fascial chain, or like front line, whatever you call it, you're teaching the brain. So you're teaching the brain that it's okay to be in neutral shoulder again. Because over time, once the shoulders have rounded, that's become normal to the brain. And when you change a movement pattern, at first it's very stressful to the brain. So that's where discomfort comes in. The brain's like, can we trust this movement? Why is it happening so often? So sometimes the brain causes pain to protect you, but you just need to keep going incrementally and you keep going, keep going, keep going. And eventually a neutral posture becomes natural.
I love that drip irrigation approach. It's interrupting the current system in a safe and calm way without the bullying and the urgency. In fact, yeah, that's where athletes, the weekend warriors break themselves. There's this kind of urgency and excess. Whereas, yeah, I talked to someone who helps people with scoliosis, and he makes sure every 8 hours they're breaking the spine's primary pattern, and it's neurological. It's rewiring, and I love what you're saying that the new normal isn't going to feel comfortable, and so that's why you give it in these tiny doses that are manageable. So you just gave our audience one thing they could do right now is walk to the door jamb, put their elbows in the door jamb and let their chest come forward, their forearms on the door jamb so that their chest can come forward and open. That's a great one.
And then your what you said earlier, deep breathe in that position, So you don't have to even count to 10. Just do three or five breaths, just nice and deep and the breathing is going to help the brain realize, oh, cool, it's okay to be in a relaxed position. It isn't a stressful position, it's a relaxed one. So that helps the brain learn it faster.
Your book is called Why Movement is Medicine. And okay, show it. Yeah. You have to say something so that it'll pick you up. Here, I'm going to mute myself.
This is my book, Why Movement is Medicine. It was published in 2020. The cover is a few buildings, just because at the time I just finished the New York Marathon. So there's a chapter 2 is my New York Marathon experience where I just applied my health principle and my health philosophy to training for a marathon. And I broke sub 3 on the first attempt, which was pretty cool. So that's chapter 2, but the rest of the chapters are all just a lot of my life story. It's not a textbook. It's lots of education about the body and the mind, but in stories. So growing up in South Africa, which was really cool. A few international travels, and what I learned about movement from each of those little stories. So it's just a few snippets. Yeah, it was a fun project.
I love it. And you have your website is movemed.co.uk, and you'll have some resources there now and later for practical steps people can take beyond the book. So I want that marathon running. That kind of brings up something to me. We talked about adaptation, that we need to slowly bring our system into its new desired state, and it's that implies several things. One is we need to visualize the new desired state. And most people I know my age, I'm going to be 58 in a couple of weeks. Most people my age in this culture have resigned themselves to like, oh, that's when you stop dancing and that's when you stop everything. And I'm just getting started. And part of that though is the patience to do those small interruptive things and look at the 23 hours of the day, not just the hour you're intentionally, if you go to the gym or if you dance or if you walk or if you run, and picking a goal. I picked sprinting because as a person with a long history of hypermobility, I picked it as something that would tighten my tissues and be bouncy and evolutionally evolved. And yet part of me wonders, should I be aiming higher like at a marathon? So let's talk about let's say you selected that marathon goal. How did it work out? And then how do you see other people designing this movement longevity from the end of the story back?
Yeah, very good question. And I think that's where goals are important, Like you must have something that you want to work towards personally. Maybe it's about swimming the English Channel. Maybe so obviously like marathons, endurance running. Like sprinting is its own beast. So like that's awesome. Um, but yeah, I think having a goal is very important. Um, at the time, like I have come from a history. My brother and I competed quite a bit. So I competed for South Africa in triathlon, for instance. Um, but yeah, so like always had a bit of a background. So like if I tell people that
A
I ran a,
bit of a background, a bit
I
of a
told,
background.
I told people that I ran a sub 3, it's like we had a background of running. So if you are a runner, sub 3 is like doable. So um, I probably shouldn't even tell people that because I think it was pretty cool. But yeah, to answer your question, I think it's goals are important, and they can be up to you as an individual. It might just be that you want to be able to pick up your grandchild when you're 100. Be able to pick up your grandchild. Like that's the best goal ever. Um, yeah,
I want to
like
be able to outrun my grandchild when I'm 100.
here we go. Like and yeah, yeah, it's just about having a goal and having people around you to help you with the accountability.
Okay,
Um,
that's a big piece, that because like I found out where the frogs in the boiling water, the water is getting warmer and warmer, and if you have no sense where you're at and no one else to tell you the water is getting warmer, or no way to compare your experience to something else. So is there anything about accountability that has occurred to you as uh, ways that people can make that happen?
Brilliant. So I think we should give some context to the listeners here that you and I only met an hour ago, but 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 we seem like we're like besties, right? So accountability is interesting. I think accountability gives you a reason to keep going. Um, accountability falls under love, the umbrella of love, and I like trying like I've like learned to try keep things simple for my patients to understand. So like we've got all these little cheesy acronyms. So the acronym for the longevity pillars is LENS. So LENDS. So these things lens to your life, whatever you want to say. So LENDS. L is love. And I think we'll come back to love last because it's the accountability one that you asked about. But E is exercise. So we've already covered like the 4 broad pillars of exercise that you can always be working on those 4 pillars. LEN. N is newness, new environment, new experiences, new skills. yeah, I mean, we've all seen it before. You know, you get to retirement and you're depressed because you just haven't got anything new to work towards. So newness is a big one, and that's what my Instagram's about, is actually new movements. I don't know where my Instagram's going to be going. I would like to do more educational talking stuff, but maybe I'll lose all of my followers because everyone's there for cheesy
A quick
dances.
fix. They're there for the quick fix.
But so that's LEN is newness. D is diet, which is a broad one. So that could be what you're eating, but also what you're not eating or shouldn't be eating, and timing of your eating maybe. And then S is sleep. I mean, it's a no-brainer. Yeah, so like those are the big pillars. So I think like in keeping it simple, work on all of those all the time. L, let's go back to L. So L is love, right? Do you have a reason to move into your 80s and hundreds? Do you have someone to move with? So your accountability, I've realized like I've met patients at all different stages of their lives. I'm sometimes just their accountability partner for a stage of their life, and then I move on, or they like move on, and they like it's a season that you're in. So the accountability can come from different types of people at different seasons in your life, but it's a big one. I think part of accountability is the gratitude, like that falls under the love umbrella. Um, Gratitude, journaling, all these things have got such amazing benefits for longevity. But yeah, if you told someone this 20 years ago, you're a quack. And now it's pretty accepted, so it's pretty cool.
Oh, wow. I love also that you used the word quack. That was a big smear in the US, at least in the 80s, as the American Medical Association was doing hit pieces against chiropractic. And I later learned to start with the word quack, 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 see what the ducks are doing. See how healthy they are. And I love that you added that love part. None of my interviews until now, we really haven't hit on in that. And that really is honestly, if that was one of the reasons having a child was one of the best things I ever did, is I can now put things through a generational lens. I can look forward or back 20 years and start to think about the ripple effect. Not that that's the only way. That's one reason I'm also a coach, is I really enjoy giving my students a reason to keep boosting their practice. And yet at the end of the day, I know some of the cheapest practices I've ever done, like when I was a yoga teacher, so I had a partner and we would just meet up to do yoga every day together. And that was another form of love. Wow. Okay. And you hit the nail on the head. We barely know each other, but we're so aligned. And guys, that's one of the most beautiful things about the Instagram movement communities, the generosity everyone has in sharing and saying yes and saying, let's keep going and not fall for accepting less than we deserve. Is there any, okay, here's one last question, because I also don't want to guilt trip anyone who had to get surgery. They didn't, my guess, they had no idea. No idea what to do to affect that outcome, or and even being able to tell when they actually need it. So since your brother is an orthopedic surgeon, is there anything you want to say as a practitioner who knows, like, because that there's a risk there too, that someone will think that what I'm doing is right for them and suffer too much and not go ahead and get the intervention they need. Is there any last thing you want to say about how do you really figure out, and the medical professionals, at least in the United States, I'm not so sure how many orthopedic professionals know when movement could be an alternative to try before a medical intervention. Anything you want to say about that?
Yeah, so I think movement should be urgently prescribed to everyone. Like I think relative, but I think everyone should be moving regardless. Yeah, sometimes the surgery is the only thing. Sometimes, like obviously if you break a bone, that's essential. But even with a joint that's degenerative, there comes a time where you have to just put all the facts on paper. And if the knee arthritis is that bone on bone, that it is really affecting your gait too much, that we know that the opposite hip is now wearing and tearing. We know that the contralateral lumbar spine is really taking strain, then you should probably intervene sooner. So yeah, like obviously all my Instagram digs are literally just digs at my brother because he's a genius. But yeah, like I think it's never too late to move. I think it's urgent, and it will just make your surgery better if you ever need it. Or it might even speed up the surgery, which isn't a bad thing. Like you would rather do surgery, like if the surgery is inevitable, you'd rather do it sooner than later. Um, yeah, my mom's literally on the other side of the screen. My parents are visiting us from South Africa because we've also got a newborn, and
Oh, congratulations.
oh, long story for off the chat. But anyway, so my mom's got arthritis in her knee, and it's a bit deformed, as in like there's like a bit of like a bony outcropping. We know it's bone on bone. So yeah, so I've taken it on myself to get her moving physically, and we've been doing the movement aid for a few weeks now, twice a week for the last 5 weeks. And the last week, my mom just said like she's been sleeping better with less pain. Like every night her knee would be giving her pain. So who like that might seem insignificant. She's going to need an operation eventually, but at least now I know like there's hope for the joint. There's we can get her improved. We can get the blood flow to the joint better. She'll recover quicker. The joint will probably last longer, the artificial joint. And yeah, overall, it's I think everyone wins. So yeah,
Wow. And it sounds like I love that you're saying don't be afraid to move. Even if what the outcome is it speeds up the replacement process, then that's a better outcome than just settling with it not feeling good and waiting around passively not moving. You brought her a curated list. And guys, that's one reason I'm also pointing you at Dr. Cuan. He's as someone who's researched movement a long time, I see the movements you've selected are very well curated, because that's one thing I have found is you can invest in a movement practice and it can actually enhance your existing stress patterns if you don't deal with the underlying stressors. And yet what you've reminded me of over and over is one of the biggest stressors is being too static. So we
yeah.
better get up and go run around a little bit. And is there any last thing you'd like to share with the audience before we go?
Any last thing I'd like to share? No, just get moving. And if you have any questions, I reply to every comment on Instagram personally. So challenge accepted.
Wow, I was so happy you answered mine and you were willing to be here today because your account is blowing up and I love your account. So to reiterate, how to find your book, Why Movement is Medicine, is that on Amazon or on your website or both?
Yeah, so Instagram is linked with my bio on the website. You can see the book, you can see my Instagram on the website. So it's all intertwined together.
Okay, so Instagram is the best way to reach you.
Probably
Move
the easiest,
Med
yeah,
UK.
yeah.
And that's
Move.
also your website.
So you probably just a parting joke for everyone. Someone said the other day, is your handle move me duck? I'm like, no, I'm like, damn it, here's the crack coming back, you know? I was like, I was like, chiropractors get enough heat already. I'm like, now I've gone and called myself a duck. Yeah.
Quack, 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 quack. Okay. Well, what a pleasure. And thank you so much for investing your time like this today. And the future is brighter than ever, thanks to people like you putting so much of your heart and soul out there. So much love for the tribe.
Likewise, Debs. Thank you for your time and love what you're doing too. Thank you.
Okay. Bye.